Can depression or other mental illnesses or any severe physical illnesses cause the government to condemn you to death? Yes, yes, in Canada. I'm not joking. Hi, friends. Thanks for joining me today. I wanted to do a couple of other videos on diabetes, and also I'm going to start a series called Amazing But True. But there's something that shocked me so much that I had to do it. This is just a little bit information for you if you're interested to scratch and dig and find out more about this horrible thing. What is euthanasia? The definition is euthanasia is the intentional act of ending a person's or animal's life to relieve intractable pain and suffering. After moving to Europe, I was shocked to see that many pet owners euthanize their pets. Okay, quite a few of them were old pets or sick pets. But there were quite a few pets that were actually healthy that were euthanized. But human euthanization? It's amazing that countries like Netherlands, Belgium, Colombia, Spain, New Zealand, and some states of Australia and US allow euthanasia. Medical professionals can inject lethal substance. Eligibility or who is condemned is due to severe and irremediable medical conditions. I know there are a lot of conditions, but can we decide who can be put to death legally? Netherlands has also legally euthanized children between 1 and 12 years of age. It was during the COVID period, I think in 2020 or so, I read about the MAID program in Canada. I thought it was a program or an app or something to find housekeepers, maids, etc. Imagine my shock when I found it is, wait, I have the correct terminology here, medical assistance in dying program. It came in 2016. I think it had come with good intentions. Let's give it the benefit of the doubt. But it got more and more twisted, and more medical conditions were added, and got very controversial as a huge mental illnesses was added to it. I know that some countries like Switzerland, Germany, Austria comes to my mind. The list is not complete, I think, that allow assisted suicide, but not euthanasia. While I was in India in December, the people were telling me about some IT professional or something in Canada. He had gone to the ER for emergency room for health condition. While he was waiting there, sitting there for a few hours waiting to be seen, he passed away. It doesn't surprise me because in all the countries where there is health welfare state thing, health, it's very different. And on the other hand, I see some families like selling off their properties. I mean, they want their children to get better life, and Canada is an attractive option. So they sell off quite a few properties and send their children abroad, either for job or education. Do they even know how the health system works in these countries? And many of the children, they stay abroad, they don't come back, they get married, and yeah, they stay abroad. Let's say there's a 10-year-old child who gets suddenly severely ill and cannot be cured. What is to stop the government from killing off the child legally? Nothing. A child over 12 years, let's say the child is very ill, severely ill, or incurable disease, and the government is thinking of euthanization, the parents have no say in it. I think a year or two ago, Netherlands did euthanize a child who was like 11 or 12. In Canada, the MAID program, the mental illness seems to play a huge part. Like, I remember reading about a father of a mentally ill daughter. Like, as he said, she was mentally ill, but not that bad. Of course, you see, quite a few people, when you say they are mentally ill, they're able to lead a good life with support. He was fighting the government against this MAID program. I have had my own issues these last few years, so I have not followed that article. But when I read about it, I was like, shocked me. Another case, this was also terrible. It was a woman in her 40s, early 40s or late 40s, I don't remember. She was living in a government flat that was humid. I think it had leakage or something. And it had mold. And that mold gave her lung issues, terrible issues. She really was horrible. She tried to get help from many sources. Since it was a government flat, probably she was living on dole. What she was offered was MAID, assistance in dying. So instead of trying to help her, the government offered her euthanasia as an outlet. Shocking. Another very horrible news is quite a few people who were depressed due to their illnesses. They were also like eligible for MAID. If depression could be an eligible criteria, yeah. And a few of them at the last minute, as the doctor was preparing to put them down, decided against it. But the doctors went through and all. And what did these doctors have? They just were reprimanded for this. These are the cases that have come to light. Many more. One of the committee members, I think it's a lawyer, she was saying people who are depressed, if we don't kill them, they will kill themselves. Really? I tried to discuss this MAID program with my friends both in Europe and in India. Most of them were not aware about it. Some of them thought this was a medical program like assisted suicide. Nobody knew it was about euthanasia and sort of legal state killings. While in India, I think December, January, I was at the holiday destination. I met a lot of Canadians. I tried to discuss this. Unfortunately, some of them didn't even know about it. Although they were living in Canada, they just come on a holiday to Kerala. And some of them, it was some of the Indian Canadians, unfortunately had the blinders on. Canada is best, India is not. It's a great health system, blah, blah, blah. I didn't want to discuss or argue or anything with them. Yes, it's great to have a free welfare state, free medical system, but at what cost? Since the program started in 2016, a decade, 10 years almost, about 100,000 people, about 1 lakh people have been legally euthanized. Sorry, MAID deaths in Canada. It's amazing that accurate numbers are not known because the primary cause of death is listed, the disease, and the secondary cause is listed as MAID, MAID. Remember, friends, mental illness, it needs, just like physical illness, it needs care and a cure. Let's not malign depression or other mental illnesses. What do you think about this? Can we let the state decide who can live and who can die because of mental illnesses, depression, or some severe physical illness? Please do comment. I really would like to know, is it just me who's shocked by this, or have a healthy day? Bye.